Hi, I'm Dan Zlot, Senior Vice President of Education and Business Development at the American Pharmacist Association. I'm also a pharmacist. Today, I wanted to take some time to talk to you about the appropriate technique for accessing COVID-19 vaccine vials. The reason we think this is important is because there have been a number of changes to authorizations and approvals related to additional doses or booster doses of COVID-19, as well as potentially doses for pediatric patients. The result of these changes may increase the number of times that a COVID-19 vaccine vial is accessed. As a result, there's an increased risk of contamination if appropriate sterile technique is not used when accessing the vial. Additionally, more entries into the vial also increases the risk of coring the stopper. So we'll review some techniques that you can use to minimize the likelihood of coring when you're accessing the vial. Step 1. The first thing we need to do is to clean our hands. Our hands are one of the biggest sources of contamination anytime we're handling sterile products. So let's start off by sanitizing our hands with alcohol gel. Be sure to wash all surfaces of the hands in between the fingers, the thumbs, the fingertips. It's helpful to think about singing happy birthday to yourself or counting slowly up to 30 while you wash your hands. It's important to keep rubbing your hands until all the alcohol has dried and your hands are dry. Now that we've cleaned our hands, we're going to go ahead and find a work area. If you don't already have a work area set aside, try to find a work area that's clean, free of debris, and out of the way so that other activities don't contaminate your chosen work area. Remember, the goal is to keep our products as sterile as possible. Before we begin, I'm going to go ahead and clean the surface with a disinfecting wipe. You'll notice as I do so that I'm wearing gloves. That's because some disinfecting agents can be pretty harsh on your skin. You should use whatever disinfecting agent is approved by your company or institution. That could be isopropyl alcohol or a bleach-based cleaning agent. Again, use whatever your company has recommended and approved for surface cleaning and sanitization. Now, once this area has been thoroughly cleaned, you may optionally, if you choose, lay out some type of a work surface covering. I'm going to go ahead and use this. This is called a Chuck's pad, and this does a couple things for me. A, it helps me neatly define my workspace, and B, it's also going to be easy to switch out in the event that something contaminates my work area. Now that we have a clean and prepared work surface, let's gather our supplies. We'll need the following: a vial of vaccine. We're going to be using a vial of normal saline to stand in for vaccine so as not to waste such a precious resource. Next, you'll need a syringe, either a 1 or 3 ml syringe, depending on the size of the dose you're administering. We'll touch on that more in just a second. If your syringe does not include a needle as part of the syringe package, you may also need a separate needle. Finally, we'll need an alcohol pad. Now, before we start getting into the particulars of how to draw up a dose of vaccine, let's take a moment to talk about potential sources of contamination. The reason this is so important is that COVID-19 vaccine vials, even though they're labeled as multi-dose vials, do not contain preservative. Most multi-dose vials contain a preservative which will kill or inhibit the growth of any bacteria which happen to get in the vial. COVID-19 vaccine vials do not. As the number of entries into the vial increases, so does the risk of contamination. Therefore, it's incredibly important to maintain good sterile technique as we're manipulating the vials. Before we get into the details of how to actually draw up a dose, let's review some of the potential sources of contamination. One of the first sources to think about is our hands. Now, we already talked about the importance of washing our hands. Our hands are the number one source of contaminants whenever we're manipulating sterile products. Therefore, it's incredibly important for us to maintain good hand hygiene each and every time we're drawing up a dose of vaccine. The next source of contamination is the vial itself. Now I'm going to go ahead and pop the cap off of this stopper. And what you'll see is, of course, the stopper. Now it's tempting to think that because I just removed that cap, the stopper here is sterile. That is not the case. This needs to be cleaned prior to first use. Additionally, as the stopper sits here exposed to air, airborne bacteria or other contaminants can land on the stopper. And as we push the needle through the stopper to access the vaccine within, we're potentially carrying those bacteria into the vial. So that's the next source. We'll talk about how to clean the stopper as we get into the appropriate procedures for drawing up a dose of vaccine. Now, the next source of contamination is, of course, the syringe. And it's not so much the syringe, it's our hands manipulating the syringe. So I'm going to go ahead and open up this syringe, and I'll show you how I do it. I am very careful to manipulate the syringe using the packaging only. As I do so, you'll notice that I'm carefully peeling away the packaging and I'm minimizing my contact with the syringe. As I continue to peel back the packaging, I'm trying not to touch the syringe. I'm now going to go ahead and withdraw the syringe. As I do so, note where I'm handling the syringe. It's okay to handle the syringe by the barrel, this portion here, by the finger guards that we'll use to depress the plunger, and by the very end of the plunger right here. What we don't want to do is to touch any part of the plunger here. This part of the plunger, because it's going to go inside the barrel, if we touch it, potentially can contaminate the syringe as we're drawing up the dose and pushing the liquid back and forth within the syringe, back and forth into the vial. So, here, or the barrel. Now, another potential source for contamination is the needle itself. I'm going to go ahead and uncap the needle carefully. And of course, you'll see the needle. Now, as long as I don't touch that needle, it's sterile. Because we're going to be doing a lot of manipulation of the syringe and the vial of vaccine, it's very easy to accidentally touch the needle. We obviously want to avoid that. It's important to prevent bacteria getting onto this needle and ultimately into that vial of vaccine. So those are all the sources of contamination that we need to be aware of. And as we go through the procedures for drawing up a dose, we'll talk about the appropriate ways to mitigate the possibilities for contamination of either the stopper or the syringe at each step. Now that we've gathered our supplies, let's check the vial before we start drawing up doses of COVID-19 vaccine. The first thing to check is the expiration date. Now, not all vials will contain an expiration date. Some will only contain a lot number. You can find the expiration date by entering the lot number on the manufacturer's website. That will provide you with the expiration date for that particular lot of vaccine. Now, there are a few other dates to keep in mind. The first date is when the vial was thawed. The Moderna vaccine is good for 30 days when thawed and stored in the refrigerator. Additionally, the Moderna vaccine is stable for 24 hours at room temperature. Whenever a vaccine is moved from the freezer to the refrigerator or to room temperature, the date and time should be noted so that the appropriate beyond use date is noted and the vial can be discarded when appropriate. The last beyond use date to keep in mind is the time of first vial entry. For Moderna vaccine, vials may be used for up to 12 hours from the time of first puncture, and the vials can be stored at either refrigerated or controlled room temperature once punctured. Now, if you're using a new vial, be sure to document the time of first puncture on the vial. Now that we've looked at the dates, we have one more thing to look at. We need to inspect the color of the liquid within the vial. The liquid within the vial should be white to off-white and may contain translucent to off-white small particles within the vial. If it's any other color, or if there is other particulate matter present in the vial, discard the vial and don't use it. Now that we've checked the expiration date on the vial and inspected the liquid within the vial, it's time to prepare the vial for use. The first thing to do is to sanitize our hands. I've already cleaned my hands with alcohol gel. I've also elected to don a pair of gloves. This is optional. If you do choose to use gloves, please keep in mind that there's nothing special about gloves that keeps them from becoming contaminated. If I clean my gloves using alcohol gel and then go and touch something else, I can bring contaminants back on my gloves in the same way that I can bring contaminants back on my skin. So you need to treat your gloves just like you would treat your skin. Now that I've gone over that, let's go ahead and prepare the vial. I'm going to go ahead and remove the cap, and then I'm going to go ahead and clean the stopper with an alcohol swab. We talked about the importance of getting this good and clean, so what I'm going to do is I'm going to clean this stopper for a good 30 seconds. Now that might sound excessive. However, keep in mind that with some of the new dosing recommendations, we're going to be entering this vial upwards of 20 times. That's 20 opportunities to introduce contamination into the vial. When I'm cleaning the stopper, note the motion that I'm using. I'm pressing firmly and I'm going around in circles. I am not simply wiping across. Just like when you wash your hands, it's important to use a full 30 seconds. And so again, a trick that I like to use is either simply to count to 30 slowly or to sing happy birthday to myself as I'm cleaning the stopper. Okay, we're coming up on 30 seconds. So now we should have a clean stopper. The next thing I'm going to do is prepare my syringe for use. Now we already went over how to open a syringe if it already has the needle as part of the syringe. What I'd like to do is show you how to open up and attach a needle when you have the syringe and needle as two separate components. So what I'm going to do, just as before, is I'm going to very carefully move this other one out of the way. I'm going to very carefully open up the packaging. And as I do so, I'm going to be very careful, in particular, about this needle hub. I do not want to contact that with my hand at any point. So I'm going to very carefully withdraw the syringe, and then I'm going to peel back the packaging, and without touching either the tip of the syringe or the hub of the needle, I'm going to insert the two and twist them together. Once I have them firmly attached, I will remove the rest of the packaging, and now I have a syringe ready for use. Now it's important to remember to use the proper size syringe for the dose that you're withdrawing. You'll note that the graduation marks on this particular syringe are in 0.1 ml increments. So this is a 3 cc syringe, and you can see 0.1, 0.2, 0.3, 0.4, 0.5, etc. Now, if I'm using a dose of 0.25, I'm not going to be able to accurately assess where that half ml mark is using the graduation marks on this particular syringe. So this would not be a very good choice if I'm administering such a small dose. On the other hand, if I'm administering 0.3 mLs, that I can do. There's a nice graduation mark there for me that I can easily find. So if I need to draw up a dose of 0.25 mLs, it would be more appropriate for me to use this 1 ml syringe. And here you'll notice it's graduated very finely for me. So there's 0.1, 0.2, and then I can get down to a nice 0.25 right there, if that's the dose that I need to administer. So again, it's very important to choose the appropriately sized syringe that will allow you to accurately draw up the dose that's to be administered. One final note on syringes. It goes without saying. However, syringes should never be reused. Syringes are one-time use items. Now that we've cleaned the vial stopper, as well as selected the appropriately sized syringe, we're ready to start drawing up our dose. Now, the first thing that I'm going to do is to swirl the vial. Now, it's very important to use the proper technique when swirling the vial. What you want to see is you should see the liquid swirl around within the vial, like so. What you don't want to do is to shake the vial. This is an example. You don't want to do that. Keep in mind that these are lipid-encased nanoparticles containing mRNA. And when you disrupt the lipid nanoparticles, you can destroy the efficacy of the vaccine. That's why it's very important to simply swirl. You should see the liquid swirling around, again, without shaking. Okay, now that we've swirled the vial, we are ready to actually go ahead and draw up the dose. So the first thing that I'm going to do is to draw up a small quantity of air, slightly smaller than the amount of vaccine that I intend to draw up. So in this case, I'm going to draw up what would be a 0.25 ml dose. So I'm going to draw up 0.22 mLs of air. Hopefully you can see that. There might be a little bit of parallax. So that's 0.22 mLs of air. Now, what I'm going to do is very carefully remove the cap on the needle and then prepare to enter the vial. Now, a couple of things to note. Number one, I want to enter the vial at a different place in the stopper each and every time I enter the vial. If you enter the vial repeatedly at the same spot, you can eventually core this vial, which means you can get a little piece of this silicone rubber stopper stuck in the needle, and that will end up in the patient. It's obviously not a good thing. Additionally, if you keep going through the same spot in the stopper, you can actually open up a small hole in the stopper, which increases the likelihood of contamination. So, if we're going to be entering this stopper as many as 20 times, it's important to use a different place each and every time we enter the stopper. To do so, it's worth inspecting the stopper closely. Now, this is a fresh stopper. There are no entry marks. So if there were entry marks, I should be able to see those, and I would want to avoid them. Now let's review the proper technique for entering the stopper to minimize the likelihood of coring. Now, what you want to do is start with the bevel up. So I'm going to go ahead and rotate this bevel a little bit so you can see the bevel on this needle. So the needle itself is cut at about a 45-degree angle. So I want to start with that bevel facing straight up, and then I'm going to make contact with the stopper, go up to about 45 degrees, and start pressing in. Once I start going in, I'm then going to tip up fully up to 90 degrees until I get through the stopper. Then I'm going to inject that small quantity of air, and then I'm going to invert the vial and draw up my dose. Now I'll do that in a separate step so that I can capture that on camera for you. So here we have the syringe and the vial just as we left it. And now I'm going to go ahead and start to draw up the dose. Now before I do, there's a couple things, just some quick reminders for us. As I'm manipulating the syringe and the vial, I do not want to touch either the stopper or the needle of the syringe. So I'm going to very carefully manipulate the neck of the vial down here. And then when I'm working on the syringe, I'm going to touch the barrel and the plunger only. So what I will do is very carefully turn this over like so. And then I'm going to go ahead and draw up my dose. Now, as I'm drawing up my dose, I can see I have a little bit of air at the tip of the syringe. Normally, one might be tempted to flick the syringe. However, if at all possible, try to avoid that. So instead of what I'm going to do is just draw up a little bit extra and then see if I can't get that air bubble to go out on its own. Okay, it's being just a touch stubborn. So I'm going to go ahead and actually inject everything all the way back in and then see if I can't get rid of it. There we go. Now I've got rid of that large air bubble. So now I'm going to go ahead and draw up my 0.25 ml dose. Turn the graduations towards me just so I can see that clearly. Okay, and there's my 0.25 ml dose. Now, I'm going to very carefully withdraw. And if we've done our job properly, there shouldn't be much, if any, liquid on the top of the stopper because we created some negative pressure by injecting a little less air than we drew out. So there should be some negative pressure left in the vial. Now, the next step is to inspect the contents of the syringe. In this case, we're using normal saline. However, if you're using the actual vaccine, you want to make sure it looks the same in the syringe as it looks in the vial, that it's still white to off-white, and that if there's any particulate, it's translucent or off-white, and again, looks just like it does in the vial. If it doesn't, you should discard the dose and discard the vial and start over. Now, depending on whether or not I'm going to use this right away, this is either going to go right into a patient's arm, or I'm going to recap it very carefully so as to avoid any needle stick injuries. And then I'm going to note the contents of the syringe as well as the date and time that this was drawn up. Once drawn into a syringe, the Moderna vaccine can be stored in the refrigerator or at room temperature and should be administered within 12 hours from the initial puncture of the source vial. All right, just a couple of quick notes as we wrap up. In the event that you find yourself with a little bit of vaccine in one vial and a little bit of vaccine in a second vial, but not enough vaccine in either vial to make a full dose, you might be tempted to combine the contents of these two vials into one syringe to allow you to make a full dose. However, the manufacturers strongly suggest that you not do that. You should not be combining contents of multiple vials into a single syringe. Well, that will wrap us up for today. We hope that you found this review of multi-dose vial technique, particularly in light of the preservative-free nature of the COVID-19 vaccine formulations, to be useful. We thank you so much for joining us, and we wish you all the best.